Hello everyone, my name's Mo.
And I'm Camille.
And welcome to the Pareto podcast.
You're definitely going to enjoy this episode.
Absolutely.
Alright, so welcome back to another episode, guys. Happy to see you back. It's Camille and Mo again. So on this podcast, we thought we'd discuss a little bit more about, the fundamentals of the NHS. As we're both working in the NHS, got a bit of history behind the NHS. Of us working within the field, within healthcare, and obviously the overarching healthcare system within the United Kingdom is the NHS. I mean, that provides the vast majority of care and people come into contact with healthcare via the NHS, broadly speaking. So we thought we'd cover the fundamentals of the NHS, whether that's the history, how it was founded, what the principles behind it, what do we strive to achieve with a national health service when we talk about the NHS, and also in terms of how people are involved with it. If people do want to get involved with the NHS, work within the NHS. It's a massive organisation with a very large budget and hundreds of thousands of people, millions of people working within the system as well, either directly or indirectly. So we thought we'd talk a little bit about the NHS, the fundamentals, how it was founded, why it was founded, and what principles continue to form the basis of the NHS.
Absolutely. We thought, we kind of brainstormed on this for a little while, didn't we?
Yeah.
And it's interesting. COVID has been a blessing and not much of a blessing as well, to be fair, but a blessing in the sense that a lot of our work as frontline healthcare workers has really been brought into light. I think there's definitely been an increased interest to understand what healthcare professionals do, what their work entails, and there's also been an increased amount of recruitment all over the shop within the NHS, whether that be people from other walks of life, finance. I'd certainly had a lot of colleagues in medical school that were working in finance, working in the industry, but just wanted to work as healthcare professionals. But also there's been quite a significant international interest as well with graduates in nursing and pharmacy and different aspects coming to the UK and wanting to work in the UK. Have you found that to be the case as well?
Yeah, absolutely. Get a lot of colleagues internationally trained from international backgrounds working within the NHS just because it's such a big employer. And obviously also it actively recruits in these countries as well, particularly in countries such as India, Philippines, and also in certain African countries as well, such as Nigeria, Ghana, and the big recruitment drives, although there are NHS employees from every single country on earth, but unfortunately some of the realities is the NHS just has a lot of vacancies, and one of the ways it fills the vacancies tries to plug that vacancies via international graduates, international nurses, international medics.
Yeah, no, for sure. But we thought we'd run this short series just to try and explain some of the fundamentals. It's kind of what we try to do as Pareto, as an organisation, where we're definitely all about fundamentals and trying to explain things well, so that you have a good amount of knowledge on those things, especially if you're thinking about maybe working in the NHS and have a few questions about this. But on a more lighter note, how's it going?
Yeah, very good. Busy, always busy. So it's always a good, chance to sit down, have a chat as well, not only for the benefit of the listeners, but also to get some different perspective from you as well.
Yeah, for sure. Have you seen anything interesting in clinical practice or?
Anything interesting? Every day is different. There's never a day where it's that's the same as the day before, which kind of keeps it interesting and keeps you busy as well. So a lot of interesting presentations, difficult things to organise. In terms of patients having certain requests, certain needs, and trying to meet them within budgetary constraints, within practicality restraints as well.
Of course.
Whether that's people with significant infections that are requiring a longer course of IV antibiotics, so that's through the drip, but a patient otherwise being well, having, fit to be discharged home now, is that a case of using a hospital bed, for 6 weeks just for that administration of antibiotics? Or can we send the patient home with a sort of outpatient service where they come in daily for the antibiotic use? I mean, that's not appropriate for everyone, but for some patients it is, and some people prefer to be out in the home environment, just coming in daily. And obviously there's practicalities around that, every day the patient comes in, are they having like a semi-permanent cannula? Are they having a more permanent, more of a long-term solution, whether that's like a midline or something like that, that we can deliver antibiotics and also infection control. There's a lot of elements. I mean, it's always interesting, isn't it, trying to arrange these within practical and, budgetary constraints as well.
Yeah, absolutely. I wish there was a word more apt than interesting, but probably interesting is the best we've got in English language, actually, so I absolutely get that. But we're here today to really talk about the history of the NHS. And it's a really interesting history, to be fair. I mean, I remember studying the history of the NHS when I was doing a BSc in healthcare management. This was kind of during my medical school. So one of the modules was kind of discussing the origins of the NHS, the context behind why the NHS came about. And that context, or the absence of that context now, perhaps explains some of the changes that the NHS is going through. And I think that will bring us to a more interesting and juicy segment. Do you know much about the NHS and when it was kind of established or how it was established?
Well, from my understanding, it was post World War II. Prior to that, a lot of healthcare was done. We had to pay for whether you're in hospital or and there were some facilities that were doing it free of charge, mainly linked with religious organisations, whether that was through the church or mainly through the church actually, in this country anyway. But for the vast majority of people, they were having to pay, and unfortunately there was a lot of suffering because of that. People are unable to afford basic healthcare, sanitation, that kind of thing, and people unfortunately passing away, and it's really suffering with the great disease burden just because of the lack of access to healthcare.
Yeah, no, absolutely. I mean, it kind of all started really with the Industrial Revolution, because a lot of prosperity was brought to the UK and to Europe as a result of the Industrial Revolution. So much industry, so much development, with that so much wealth. You obviously had, the period of transatlantic trade. You had new herbs and new spices and new fruits and vegetables kind of introduced to the British diet and European diet. So people's health needs started to change. A lot of research retrospectively was done at this point. People were living a little bit longer, but because people were living and working in industrial environments, there were also a number of industry-related health issues that were being found. So you had the Great War in World War One. People in the trenches. Did you ever read those books, Horrible Histories? Do you remember those, like the cartoon books, and they'd explain what's going on in primary and secondary school. But so you had like the dirty trenches, and you had all of the disease and the bacteria, etc. You had outbreaks like cholera, etc. And then you had World War II as well, which brought once again a lot of death, a lot of injury, wound infections, disability and debilitation as a result of post-wound, even mental health issues like post-traumatic stress disorder and other things. So the disease profile and the health profile of the British public started to become quite complicated.
Yeah, and I think around that time there's a lot of move to cities rather than agriculturally living in countryside.
Yes.
There's a big move to cities, and also there's a big population boom as well. So a lot of these factors coincided.
Yeah, absolutely. And I think naturally, the other big one that probably not everyone wants to talk about, but the big thing that was just across the shore was the communist threat at the time.
Yeah.
Because of course Britain at the time was an industrial capitalist country. Still is an industrial, well, not an industrial country, but a capitalist country. It was more about kind of the capitalists and the distinction between the landowners and the industry owners and the workers. But in communist Russia at the time, it was more about kind of equality and the fact that the state the state would give everyone certain rights, welfare and healthcare and etc. So research showed that the Brits were obviously feeling like we should probably have a stake. We need our health to be looked after. We need our bodies to be looked after, especially because we're contributing to the welfare of the country, the overall welfare of the country. And it was all of those factors that came together, as you said, that led to what we call the post-war consensus. That health needs are pretty complicated.
Of course.
Life needs are pretty complicated.
Yeah.
And the current systems at play are not really designed to help people through their suffering. Because at the time there was something called the national insurance model.
Okay.
And everyone pays national insurance contributions, right?
Yeah.
That model existed since the 1920s, actually.
Okay.
And that was about basically people paying a stipend to the state, and the state basically allows you access to a GP.
Okay.
But despite that model being in place, so for example, if you were working for an industrial company, you would be paying national insurance contribution, as an example.
Okay.
However, that would be a contribution only for you, not for your family.
Okay.
So if you were to get ill, you would be in touch with a GP, and the GP can talk to a hospitalist or whatever. But let's say, for example, you went out to a mine and you brought a disease back home, and your kids get unwell, or your wife gets unwell, your family gets unwell. None of them are covered. So that creates a massive problem. Actually, about 40% of the British population, 40 to 50% of the British population were not covered with healthcare at all prior to the NHS basically coming into existence.
That's a massive swathe of the population.
That's massive, isn't it? I mean, it shows you that there was definitely a dire need. And really it was later on something called the Beveridge Report.
Okay.
I think it was 1943 that was done. And that was basically probably one of the only times when there was a cross-party consensus. For anyone that's not really in tune with British politics, there's never usually a cross-party consensus. But they all agreed that, look, things are pretty dire. Things are pretty. There needs to be some changes to healthcare, and that's when ideas and books and poetry and even fiction and non-fiction writing started to come out about what a health service should look like.
Okay.
And then you had Bevan. I think you reminded me of Bevan, didn't you, earlier? 1948 was when Bevan, who created what we call the NHS Charter, the National Health Service, at the time.
So if you could go back to a pivotal moment, probably that's the little ember of the NHS. That was when it's slowly started into an actual flame.
Yeah,
that's a metaphor for you.
That's a really good metaphor. I'm always surprised by Camille on a day-to-day basis. Known him for a little while, he comes out with lines like this, and I do wonder where he's getting this from. But anyway, but that's pretty good, man. Yeah. That's pretty much 1948. So you had the creation of the NHS.
Yeah.
The principles were pretty simple, Cam. They were that NHS's healthcare should be free at the point of access, which it still is.
Which is, if you think back to that time, just post-war, with just, the British Raj was coming to an end, the country was financially, not in the best of positions, which can be sort of emulated today, in certain aspects, where the country is, financially not in the best step, but despite that, they felt that, the politicians of the time, down to public pressure or, with the amount of research that was coming and all these kind of things, felt that this is the time to invest in our people. And I think these kind of investments reap dividends. Because as you can see, if the health of the population, and another fundamental is education. So if health and education of our population is sort of taken care of, then that population is able to be fit and healthy enough, and also educated enough to provide good productivity and output.
Absolutely.
So if you just think about it in plain and simple terms of, we remove empathy, we remove this kind of, human emotion, it's just a simple economics equation, isn't it?
Absolutely. And I think that's probably where the genius of the NHS comes from, because the motivation at the time was altruistic. It was people were suffering. But of course, it brings a huge number of economic benefits, like you mentioned, because a healthier population means a more productive population. More productive population means more production and a more efficient and faster growing economy. And that's pretty much what the trajectory has been since the establishment of the NHS.
Okay.
Free at the point of entry, and really free for anyone who is, a British citizen really at the time. Of course, that's been extended to people who are of, citizens of Europe, you could say, although that's always in question based on Brexit, but, genuinely and generally it still applies. Mm-hmm. And it's based on clinical need. And the whole thing was a tripartite system is what they called. So you had, the integration of, various different organisations. So you had, community general practice. Within that was like dentists and pharmacists and opticians and other allied health professionals, integrating that with hospital care, because before there was quite a big distinction. And then finally integrating that with community services. So it was the first time community service was ever recognised. So, community service specifically for the elderly, community service specifically for mental health. So as early as 1948, some of these constructs that we're quite used to right now in our healthcare practice started to evolve.
And at the time, it's very, very groundbreaking. I mean, Britain was one of the first countries to sort of adopt this model, in terms of free at that point.
Yeah.
That's revolutionary.
I think it still is. I think Brazil is the only one that has a similar service to Britain, because most countries around the world still have an insurance-based system. Certain Middle Eastern countries at the moment are trying to emulate what Britain does with a primary care, secondary care. But we'll go through a lot of that in a separate video. But the origins of the NHS and the way the NHS was made, the history behind it, has really set the standard for good quality healthcare. And look, despite the issues of the NHS right now, based on budgeting, etc., it's pretty robust. It does what it needs to. Yes, okay, things take a little bit of time, but health needs have evolved since 1948. People are living longer. There's more complicated health needs. We know health is influenced by so many different factors.
Absolutely. Yeah.
But the actual basic structure and the ethos of the NHS has largely remained.
Yeah.
And I guess when you commit yourself to an organisation like this, you commit yourself to the ethos, to the history, to the heritage, through to the fabric of the NHS, which prides itself on patient care, free at the point of access, which, as you mentioned correctly, so is groundbreaking.
Yeah, and with the NHS, I mean, millions of people use it on a daily basis. The views will be testament to the fact that they'll either be working in the NHS themselves, someone that they know, they'll be using NHS services, and that's one of the reasons why, consistently the British public, I say, in terms of what they're most proud of in the UK, is the NHS. That top surveys again and again. And that's not an easy thing to do, despite the challenges which you mentioned earlier. People have been living longer with multiple comorbidities, meaning they have a lot of other disease profiles, whether that's diabetes, heart disease, high blood pressure, longer term conditions. But the NHS still pride itself on providing this care. We still, some of the within the NHS and its wider bodies that are associated, conduct groundbreaking research to this day. New treatment pathways. There's specialist services in this country that that are world renowned really, and people come from all over the world to seek treatment here. And whether that's in specialist centres such as Great Ormond Street Hospital, for paediatrics, whether that's, certain heart and lung specialist centres, some of the groundbreaking medical breakthroughs have been done via the NHS in the UK, and, it's impacted, countless lives.
Absolutely. Do you watch The Crown?
I've not seen it yet.
Oh, it's a good show, man.
Okay.
It's a good show, but anyway, it's in quite a good season at the moment, that one at the moment, which is, it's about Thatcher.
Okay.
And the relationship between Thatcher and the Queen.
Okay. Two very powerful women in their own right. right?
Of course, absolutely right. And Thatcher obviously had a number of, what you would call as political victories. Falkland War as an example, and some of them were morally questionable, with the miners' strike and etc.
Yeah.
But anyway, but she couldn't do, despite her belief in privatisation, despite her belief in
Market forces
and the free market, etc. I mean, she recognised that the NHS was pretty groundbreaking. Like, it was an institution that you can't really fault, because it was something that is largely contrary to pure capitalist free market economics, because it's state involved, but it ultimately benefits free market capitalist economics because it produces a healthier workforce. I think for her to admit to that, and she's probably one of the most pro-free market prime ministers that have been around in recent history.
Yeah.
It's pretty interesting.
Definitely.
Yeah.
I mean, I think the NHS, if we talk as a broad sense, is just, for what it's been doing for so many years, and yes, there are challenges. We can admit that, there are perhaps different things that certain, swathes of population perhaps believe that certain things would be more effective. Is it in terms of value for money? Is it, but if we compare it to, other countries where different models are adopted, I think it's one of the best values for money. But like I say, with anything there are challenges. It is challenging to provide free point of access care for long-term conditions. There are long waiting lists, we have to admit this. For certain elective procedures, meaning planned procedures such as hip and knee replacements, certain surgeries, certain gynecology procedures, mental health access is struggling right now. There are very long waiting lists, such as for a wide variety of mental health disorders, autism screening, that kind of thing, and also general practice as well works slightly in a different model, but does come within the umbrella of the NHS.
For sure.
And you can access that through the NHS as well, and people are waiting. There are also some things that we do. There are charges for within the NHS, whether that's prescription charges. So when you pick up any sort of drug, any sort of medication, so your general practitioner, GP writes, that's your family doctor, writes a prescription for you, for example, an inhaler for your asthma, you will have to pay for that, and that's a set charge. I think it's currently £9.80, something like that at the moment, and that's something that you have to pay, so there is a little bit of contribution. And also, things like dental services, there is a contribution towards that. And also optician services as well. So it's not just everything is free, and that's there are certain aspects of it. There are charges, and I think some of them charges have been around since NHS was first founded. For sure.
Yeah, I mean, I think that's probably our summary of the origins of the NHS, the history of the NHS, which forms the first part of this NHS Fundamentals series.
Yeah.
Of course, if you've got any personal experiences that you'd like to share about, the NHS, or any additional information that we might not have known in our research for this episode, please do comment. Please like, comment, and subscribe, and do follow us for our next escapade in the NHS Fundamentals series from Pareto. But is that a wrap?
Yeah, that's a wrap.
Take care, guys.
Bye bye.